The correspondent Ione Wells has been following the story. And Ione, what's this letter in response to?
Evening, Nick. Well, there's no getting around the fact that the situation in Wales is very serious. 2 out of 7 local health boards have suspended non-critical care in response to rising coronavirus infections. Latest figures show that there are now a record number of COVID patients in Welsh hospitals. Over the last few days as well, we've seen the likes of the Welsh Intensive Care Society warn that critical care would not be able to cope over the next few weeks without interventions at the highest level. And we also know that Wales is currently in breach of certain key indicators that would trigger future lockdowns, things like the current coronavirus case rates, but also concern about hospital capacity. And all this has led the Welsh Secretary to say that help is available if needed to ease pressure.
What we wanted to make clear to Mark Drakeford and Welsh Government is, look, if there is anything we can do to help, let's put down our sort of political differences for a bit. Let's not worry too much about the political boundaries, and if you have a particular problem in a particular health board area which you think could be relieved by perhaps tapping into some support the other side of the border, we're very happy to talk and see if there's any way we can help resolve it.
This principle of mutual aid isn't something new, however. Earlier, Mark Drakeford reiterated the fact that, for example, Wales had provided about 11 million items of personal protective equipment to NHS England when it was needed earlier this year. And as a result, there has been some criticism of this letter today, with the Welsh Minister Lee Waters, for example, accusing UK ministers of posturing by publishing this offer as an open letter. But the First Minister, Mark Drakeford, has said that he will respond to it and that he endorses the principle of mutual aid, something that has been present throughout the coronavirus pandemic.
OK, Ione, thank you very much indeed.